Welcome to Politics NY with Skye Behind the Curtain. We are with Dr. Yaneer Bar-Yam. He is the president of the New England Complex Systems Institute and an extremely accomplished scientist. In fact, he's an expert on pandemics with decades of research on pandemics and outbreaks. So welcome to the show, Dr. Bar-Yam.
Thank you.
And the main question that I have for you today is, what are we doing wrong? This virus has been around, it's in the news, there's another variant. We're heading into New Year's and people are panicking. They can't get together. You can't even get a rapid test because everyone's freaking out. So what are we doing wrong?
We can stop the virus, but we have to decide to. It's like, it's really very much like having a fire in your house.
Okay.
If you decide that, hey, there's a fire, but I can't put it out. And every time someone says, let me put it out, they say, no, we can't put it out. So what's going to happen? The fire is going to go up until it's a huge fire. And then you say, no, I'll find it out. So you work hard, you panic, you put it out, and then it goes down a little bit. And then people say, no, we can't put it out. So of course it's going to come back again.
Mm-hmm.
So the real point is the following, and it's really that simple. You don't need a degree in virology or anything else to understand that if you have a fire in your house, what you really have to do is put it out. And the Western world, unlike much of the Eastern world, has decided that it can't get rid of this. And so every time we start to do something, people tell us, no, it's okay, don't worry, it'll be all right. And then we stop doing what we should be doing, which is trying to get rid of this. So, right now, India is almost at elimination after China showed that it was possible to do it. And so is Indonesia and Japan and other countries, Philippines. And the reason why the countries are now able to get to elimination is different from when China did it, which is what they're doing is they're using vaccines plus strategy, which means in addition to having the vaccines, they're not giving up on masking and social distancing and having schools be remote and all of those things that we know will help stop the transmission. If transmission stops, the virus dies.
Mm-hmm.
If we keep letting the transmission happen, then it just accelerates and the virus gets worse and worse. And all of this idea that somehow it'll get mild and we won't have to worry about it is wrong, right? Right now, people are saying Omicron is mild. That's bullshit.
So what should we be doing?
And the answer is we just have to go back to the basics. There's no magic here. Mm-hmm. You can't say, hey, we're going to pretend that it's okay. What we have to do is say, we have an opportunity to take ownership of this problem. And it's mostly the community. It's not a government action. It's not a medical system action. The doctors will treat you if you get sick, and many people will die, but they can't prevent you from getting infected. You, everyone who's paying attention to this, and all the people that pay attention to them, their families and friends, and maybe their constituents, will pay attention if they say, it's on you to stop this from happening.
See, you were saying that people aren't panicking enough right now, but I think the evidence is that people are panicking. If you're out there in the community.
They're not panicking enough because they're not deciding that we have to work together to stop this.
I would say that that's what's happening now, though, being a member of the community, seeing the lines at these testing centers. I myself went to go get a rapid test before coming up to Boston last weekend, and it took 4 hours of waiting in line, driving around, calling places because so many people were waiting in line to get tested.
In order to do mass testing, in order to stop the pandemic, we have to test everybody.
Mm-hmm.
And the best way to do it would be to test frequently, like every day, even twice a day.
Mm-hmm.
And if we did it at that level, then we would get the cases to drop exponentially. And once they're dropping exponentially, then we have the chance to stop it. We have to commit ourselves, not just to doing it when the cases are high, but to commit ourselves to doing it when the cases are low so that we can get out of this, right? When you have a small fire, you don't walk away from it and start reading a book.
Right. So you're saying, Dr. Bar-Yam, that if we don't keep testing and get this virus down, that there will be more variants.
That's right. We've done it before. It doesn't, again, all of this business about, hey, it's mild, all of this business about, hey, it won't be bad, or in the future it'll be, quote, endemic, which sounds to me, people think it's going to be like the flu or something, or a cold. It's just nonsense.
So that's
endemic diseases can be super awful. And in fact, this one is showing that it gets worse and worse, not better.
So what's your message to anyone who's listening as a next step for each person? Because you said it's up to the community. So what should each person do?
Get together with other people and decide that you're going to stop it. And if you want, you can take a look at the World Health Network, which is just an organization that is designed to coordinate community activities with scientific groups. And the purpose that we have is to get strong action so that we'll get out of this pandemic, which is really what we all should be doing. Stop listening to the nonsense that's coming out of the New York Times and the Washington Post that are saying, hey, it's not so important, because it is important. We've got to take this seriously.
Okay, that's a good tidbit right there. So, final question. So anyone who's double vax and boosted, are they doing enough?
And the answer is, Omicron gets past all of that. It's really so different from the previous variants that maybe you get slightly less severe disease, maybe, but you don't want to bet on it, because the hospitals are going to be overflowing and people are not going to get care, and the death rate is going to go way up for even people that have not so severe disease. And that's about the individual trade-off at that point. And then there's long COVID with all of the brain damage. People really should read about the brain damage from COVID. It's a terrible situation. With the brain fog and the long-term effects, it's really not something that we should be playing with. This is not the right fire for us to be playing.
Wow. A very serious message here from Dr. Bar-Yam. Thank you for sharing your thoughts and expertise with us on PoliticsNY with Skye.
Thank you.